Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Do your joints hurt? Are they swollen? You might have arthritis. According to the Centers for Disease Control and Prevention, more than 54 million Americans in the United States are living with arthritis. So what causes it and how do you treat it? Joining us to talk about this is Dr. Kavitta Allem. She's a rheumatologist with Scripps Clinic in Oceanside, California. Doctor, thanks so much for being with us.
Thank you, Susan.
In a little bit more detail, explain what is arthritis?
Arthritis is a condition where various joints can be affected, either hands, knees, feet, back, but generally is manifested by pain in those joints.
And why is it so common?
Well, there's lots of different types of arthritis, but the most common being wear and tear arthritis, which affects most Americans worldwide, most populations.
And when you say wear and tear, what kind of arthritis is that? Talk about the different types.
So in terms of arthritis, we as rheumatologists classify arthritis into inflammatory versus non-inflammatory. Non-inflammatory arthritis is degenerative arthritis, osteoarthritis, also referred to as degenerative joint disease and various other terms, but essentially comes naturally with aging. It can be worsened if you've had an injury or you've had trauma to a joint, but occurs with most patients over time.
So what triggers a flare-up?
Oftentimes it can be different, but for a lot of patients, it's things like activity. Sometimes weather changes really affect our patients. Things like cold weather, things like rainy weather really seem to make pain and stiffness worse.
And who is more prone to arthritis, men or women?
It occurs equally across both groups of patients. Patients can be different in where they have more arthritis. Some people have more back, some people have more knee or hip or hand, but it occurs equally across males and females.
So what are the symptoms? And do they come on suddenly, or does this kind of occur over a long period of time?
It really depends on the type of arthritis. For degenerative wear and tear arthritis, which is our most common type of arthritis, symptoms tend to occur more slowly over time, first occurring every now and then becoming more chronic, more persistent. For our rheumatoid arthritis patients, they tend to see swelling in these joints and these joints here, which helps us differentiate them. It can also vary for those patients. Sometimes it comes on more slowly and sometimes it comes on more suddenly for them.
So in a little bit more detail, explain what is rheumatoid arthritis and osteoarthritis.
So rheumatoid arthritis is an arthritis of the immune system. So the immune system is going after your joints, trying to essentially take out something that it feels like shouldn't be there. I often tell patients, think of it like a cut that gets infected, that your immune system goes after. Red, hot, angry, tender, swollen is often what our rheumatoid arthritis patients feel. Degenerative arthritis just behaves differently. There tends to be more of a low level of inflammation, although still there.
And then what about psoriatic arthritis? What is that?
So psoriatic arthritis is another immune-driven arthritis that behaves a bit differently than rheumatoid arthritis. Oftentimes, patients have a history of psoriasis. Their amount of psoriasis, in fact, does not affect how much arthritis they have, but it can occur in various different parts of the body, including the hands, the feet, the back.
And can this be treated as well, or is this a condition you have to deal with for your life?
No, there are fantastic treatments for psoriatic arthritis, rheumatoid arthritis, gout. We've really come a long way in the past decade in terms of helping our patients live relatively symptom-free lives.
And what is the relationship between gout and osteoarthritis?
So gout is also an immune-driven arthritis. It's very inflammatory. What essentially happens is your body is reacting to crystals/gout crystals that are occurring in your joints. The joints that have gout, the symptoms come on very suddenly, generally over the course of a night, very painful, very tender, very swollen, and oftentimes patients can't even walk because the pain is so severe.
And talk about the relationship between osteoarthritis and gout.
There's not a direct correlation between osteoarthritis and gout, but we do know that joints that have had gout inflammation tend to get early osteoarthritis in those joints.
And osteoarthritis is in the what?
Osteoarthritis can occur anywhere. In the hands, it occurs here at these most distal joints, are the ones towards the end of your fingers, and also these ones in the middle. Rheumatoid arthritis likes these ones closer to your hand and then in the middle as well. So there's a bit of overlap that can occur. Osteoarthritis really likes the thumb as well.
And then what about gout? What parts of the body does it affect?
Gout can technically occur anywhere, although generally for most patients, their first episode of gout will be in the feet. We often see it in the feet, the ankles, sometimes the knees as well.
So how do you know it's arthritis and not an injury? Let's say you run 2 miles a day, or you play soccer, or you play tennis.
So injuries tend to be more acute in nature. So arthritis tends to be more chronic. And I've had several patients who initially thought their symptoms were related to injury, but the longer they went on gave them a clue that something else was going on.
And so when you say, what's the time frame on that? If it lasts longer than what?
So some injuries can take a long time to heal, but if something is lasting for several months, that would definitely be a reason to have a provider check you out. If there's any swelling in your joints, that's a reason to have someone take a look.
So how do you treat arthritis?
So it depends on the type of arthritis. For osteoarthritis or degenerative arthritis, our goal is for you to remain as active and independent for as long as possible. The treatment for this involves a combination approach, oftentimes with physical therapy, over-the-counter or prescription anti-inflammatories to help reduce pain. At times, injections of steroids into joints can also help relieve pain. And typically, as a last resort, surgery can sometimes be indicated for some patients in the form of joint replacement as the most common type of surgery.
So you referenced this a minute ago, but just go into a little bit more detail. If you're diagnosed with arthritis, should you limit your physical activity or should you increase your physical activity?
In regards to physical activity for osteoarthritis, really it depends on the patient and where they are. Anything that's causing a significant amount of pain, definitely pain that's lasting several hours after you complete an activity, is probably too much. Sometimes you have to modify what you're doing when you have osteoarthritis. I often will encourage patients to cross-train, whether that be weight-bearing activities that they enjoy, such as running, but also mix it up a little and do some aquatic-based activities as well to take pressure off those joints.
Like a stationary bike.
Stationary bike works, walking in a pool works, lots of different ways to sort of approach that.
So at what point should you say to yourself, this pain in my joint is not going away. I really need to go see a doctor?
I think anything that, number one, you're concerned about is something that you should see a physician about. Anything that's limiting your ability to be active, that's something that we want to address and try and help with.
Any final thoughts, doctor?
The osteoarthritis, again, is the most common type of arthritis that we have. Rheumatologists specialize in treating autoimmune types of arthritis. So these are arthritis you may have heard of, including rheumatoid arthritis, psoriatic arthritis, gout, and some others. We use sophisticated medications, injections, imaging, physical therapy, a combination of approaches to help our patients with autoimmune disease live a sort of more active life.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you.
If you want more information on arthritis, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.